Now, COVID's shadow over polls as the country witnesses a sharp spike in Omicron cases. As 5 states prepare to go to polls early next year, the Election Commission now, the top brass, has conducted key meeting with Union Health Secretary over growing Omicron concerns. The top election body has sought a report from poll-bound states on Omicron after hour-long meeting with the Health Secretary. The Election Commission will be meeting the Health Secretary again in the first week of January to assess if the situation is conducive for polls. Poll panel officials also met Special DG BSF on deployment of paramilitary forces for the state polls. The Commission may also seek suggestions on improving protocols for poll campaign, polling days as well as dates for counting. Now, this comes after the Allahabad High Court urged the government to consider postponing the UP Assembly polls and banning all political rallies amid fears of an impending third wave of COVID-19. Now, with the rise in Omicron cases across the nation, Home Ministry has now issued orders to all states seeking local-level curbs, containment measures to keep the Omicron threat at bay. The centre has asked all states to observe precautions and not let their guard down. The country has so far reported a total of 578 Omicron cases. Delhi has reported the most with 142 cases. It has also now become the latest state to reintroduce night curfew in the wake of the surge in COVID cases. The night curfew would be applicable from 11 p.m. to 5 a.m. starting tonight. Maharashtra reported 31 cases, its single highest detection in a day's time, taking the state's total tally to 141. The state had earlier issued a strict night curfew from 9 p.m. to 6 a.m. All New Year's Eve celebrations have been banned in the city of Mumbai. The new surge has also dulled wedding season. The government has put a cap of 100 guests only for indoor weddings and 200 for outdoor weddings. The new guidelines have also restricted capacity of gyms, spas, hotels, theatres, cinema halls to 50%.
The count of Omicron cases in Maharashtra now stands at 141, and Mumbai itself has 73 cases. Yesterday, the state recorded 31 new cases of Omicron, and Mumbai itself has 27 cases. In the entire state, Mumbai is the worst affected city, and the state government and the Mumbai Municipal Corporation has come out with various guidelines for the people. But the marketplaces in the city and the various suburban areas are still full. No COVID-appropriate behavior is being followed there. The transportation system is jam-packed as ever. Not many are abiding by COVID-appropriate behavior, and the health experts say this could be dangerous. A member of the state COVID task force says that the next 2 days are going to be very, very crucial. Even though new guidelines have been rolled out by the state government and the Mumbai Municipal Corporation, the situation on ground zero cannot be said to be very good, as not many people are abiding by the rules and regulations, even though the BMC and the state government has said that strict action is going to be taken against people if they flout the rules. The situation continues to remain grim in Mumbai and Maharashtra as cases are only rising. The COVID numbers in Mumbai yesterday stood at 922. The count of active sealed buildings is also rising. Mumbai now has 22 sealed buildings as well. And the health experts say that the only way to remain safe is wearing masks at public places and abiding by COVID-appropriate behavior. With camera person Mahesh More, this is Pankaj Upadhyay in Mumbai, reporting for India Today.
All right, now let's take a quick look at India's Omicron tally so far. Let me take you through the number of cases that have been reported in several states. Let's start with Delhi. Delhi has reported now 142 cases of Omicron. And then you have Maharashtra reporting the next highest with 141 cases of Omicron. And then we have Kerala reporting 57 cases of Omicron in just the last few weeks. Gujarat has reported 49 cases of Omicron. Rajasthan has now reported 43. We're looking at a total cases of Omicron in India now at 578. Now, as the country prepares to mobilize vaccine doses for booster shots and jabs for kids, India has now vaccinated, or at least begun activating its share of vaccine doses in the COVAX alliance to make more doses available for India as well as those countries that they're supplying. Now, this would be doses of Covishield, by Serum Institute of India. States and union territories are currently equipped with 17.9 crore doses as balance. Moreover, orders for 20 crore doses have also been placed by Serum Institute of India and Bharat Biotech, which are currently the pipeline. Now, total of dose projection here is about 58 crore approximately. Meanwhile, Prime Minister Narendra Modi, while speaking at an event in Himachal Pradesh today, spoke about India's mega move to begin the booster rollout, and he spoke about advantages of vaccinating kids. Let's have a listen.
हमारे जो हेल्थ सेक्टर के लोग हैं, फ्रंटलाइन वर्कर हैं, वो पिछले 2 साल से कोरोना से लड़ाई में देश की एक बहुत बड़ी ताकत बने हुए हैं। उन्हें भी 10 जनवरी से प्रिकॉशन डोज देने का काम शुरू होगा। 60 साल से ऊपर के बुजुर्ग जिन्हें पहले से गंभीर बीमारियां हैं, उन्हें भी डॉक्टरों की सलाह पर प्रिकॉशन डोज का विकल्प दिया गया है। 15 से 18 साल के बीच जो बच्चे हैं, बेटे बेटियां हैं, उनको भी 3 जनवरी सोमवार से वैक्सीन लगाना शुरू हो जाएगा। 3 जनवरी सोमवार से अभियान शुरू होने वाला है। मुझे विश्वास है हिमाचल प्रदेश इसमें भी शानदार काम करके दिखाएगा। देश को दिशा देने का काम हिमाचल करके रहेगा।
Well, now, after Prime Minister's Christmas announcement to boost India's vaccination drive, India Today tells you all that you need to know about how to get these booster shots and how to vaccinate your children starting from the 3rd of January. Well, the COVID portal has now made children's registration for vaccination quite simple. Children between the age of 15 to 18 years qualify for the first jab of the COVID vaccine. Platform for teenagers and registration for them to open up on the 1st of Jan 2022. Right now, the COVID portal will have only one option, Bharat Biotech's Covaxin, as Zydus Cadila, though approved, is only currently available, or that's allowed to be given only to adults. Children can register with their family members and can also register separately. Student ID cards can be used, as well as if at all they don't have another ID or an Aadhaar card, then an ID card should suffice. One mobile number can register 4 members of a family. Children can also walk into the nearest approved center for vaccination for them. This will be decided by state governments. Now, for those above 60 with comorbidities, will have to furnish a letter from the doctor and will have to also have an option to pick their desired booster shot. So it's made quite simple. Those looking forward for a booster shot, if you're in the bracket of the healthcare frontline worker or above the age of 60, then you are likely to get your booster shot. Now, children too, to easily avail their jab.
Prime Minister has opened vaccinations for 15 to 18 years of teenagers. So they also have to register in a similar fashion, or can they club their registration with their family members who had earlier registered on COVID? Or will that be a separate one?
Absolutely, wonderful question. What can happen, as you know, one phone allows as much as 4 registrations. So let's say husband and wife are registered and they are 2 children which are between 15 to 18 years of age. They will be able to create entries for their children. Okay. Alternatively, children can also register themselves separately. So whichever way it is comfortable for them, they can do that. And children of born in the year 2007 or before, that is 2006 and 2005, will be eligible for getting the jabs for the children. Now, the Honorable Prime Minister has announced that from 10th January onwards, people with both doses completed and 60 years of age, and also with comorbidities, and also those who have completed the second dose 9 months prior to the date, who have completed 9 months after their second dose, will be eligible for the additional precautionary dose, and they will be able to register on the COVID platform. They will also be able to go to any vaccination center, even if they are not registered. And then if there are vacancies there, they will be able to get the they get the jab, the third jab, and get the certificate thereof.
So you're saying that if one can't register on COVID, they can also walk into the centers similar to what was happening earlier?
Exactly. There's absolutely no change. The process remains exactly the same. So those people who are already have 2 jabs, which means they already know the process. Now they are already registered on our platform. If they want to, they can just open the platform, and the platform will say, yes, you are 60 years plus and you are now eligible for a 3rd dose. And then it will ask another question, which is basically, are you having any comorbidity conditions? And he says yes. Then he or she says yes. Then thereafter, the platform will enable them to register and get appointment also for, they are already registered, in fact, on the platform. They will get an appointment for a 3rd dose of vaccination from any of the centers near their homes or the place where they reside, and they will be able to get the vaccine.
All right, let me quickly take you through some of those questions that are now on our minds on vaccine for teens, for children above the age of 15, between the age of 18, will now be eligible to get their vaccine shots. Some of those questions, let me answer that for you. Which age group is eligible? Of course, like I've mentioned, teenagers aged between 15 to 18 are eligible to get the jab. Now, there are questions on where that you can register for the vaccine. Those children wanting to register themselves can log on to the CoWIN portal, the CoWIN platform that's currently been tweaked for kids to register, and it's made a lot simpler and easy for them to maneuver through that app. What proof of identity will you need as someone eligible in that age bracket of 15 to 18? Well, a student ID card or a family member's ID, in case you don't have an Aadhaar card, will suffice. When can you first register for the vaccine? Registration for vaccine will be allowed as early as the 1st of January, in just a couple of days' time from now. Which vaccine will be available for you? Well, Covaxin, as of now, has been given the nod by DCGI. Where can you get the vaccine? Well, state government approved vaccine centers, just like how it worked for adults. Even teens will have to go to all of the state approved, state and government run vaccination centers. Of course, we know that this is a big move now, not just vaccine for kids. We're also looking at booster doses now that has come into effect, which will be rolled out post the 10th of January. Booster shots significantly restore protection against mild disease caused by Omicron variant, is what's believed by experts, in part reversing an otherwise steep drop in vaccine effectiveness, according to the UK Health Security Agency. Now, I'm going to take you through all that and more with regards to booster shots.
COVID booster shots could provide up to 75% protection against symptomatic infection from the Omicron variant. That's according to the UK Health Security Agency. In their real-world analysis that looked at 581 people confirmed with Omicron, it found that 2 doses of AstraZeneca or Pfizer-BioNTech vaccines were less effective at stopping the new variant compared to Delta, but that a 3rd shot prevents around 75% of people getting any COVID symptoms. Dr. Susan Hopkins is the Chief Medical Advisor for the UK HSA.
People who've had 2 doses more than 3 months ago are likely to get infection and transmit infection. What we see is after the booster dose, and that happens quite fast after the booster dose, in early analysis, probably at 14 days and even up to just even 7 days, that effect is reversed. And actually what we're seeing is, no matter what your backbone, whether you had Astra or Pfizer, you've got a 70 to 75% vaccine effectiveness for a symptomatic disease.
Hopkins went on to warn that at current growth rates, Omicron will account for more than half of all COVID-19 infections by mid-December, with Britain exceeding 1 million infections by the end of the month. While no cases of Omicron have yet resulted in hospitalisation or death, the health agency says they still don't have enough data to assess the severity of the variant. On Wednesday, Prime Minister Boris Johnson announced new measures to try to curb the spread of the disease.
Employers should use the rest of the week to discuss